Hello and welcome to the Art of Being Human. The last segment we spent on pain and why pain becomes a chronic condition and what you can do about it and how you describe it, how you deal with it. And we're going to continue with that today and finish with it today. Pain is so prevalent. Everybody has pain, but some people seem to be dogged by it a lot more than other people. And for some people it seems to be worse than for other people. What for me might be a pinprick might be for some people excruciating. So why would I consider it a chronic illness? Because pain goes along with a lot of chronic illnesses. A lot of chronic illnesses have pain as part of its characteristics. And when that happens, you're living with a lot of pain. Then what do you do about it? If you're a person who's living with a lot of pain, what do you want to do? You can't live a normal life. Let's say you have migraines. Migraines can be excruciating. I've never had a migraine in my life. I can only talk about what people have told me migraines are like, or look it up in medical textbooks. But I know that the pain of migraines is so severe, they can actually see an aura before it happens, like they were going into the seizures. And you know, there is a relationship between seizure disorders and migraine headaches, but I'm not saying people who suffer migraines are all going to go into seizures, but there is a similarity between them and a relationship between them. But migraine headaches are so bad that most people want to go into a cool, dark place and rest and not have any noise and not be touched by anybody, and they're just separating themselves because the pain is so severe that they cannot live a normal life. And they have it several times a week, sometimes several times a month. It should always be checked. Sometimes you can get pain due to a brain tumor, although the brain itself does not feel pain, but certainly the tissues around it and the bone structures around it do feel pain, but the brain as an organ does not feel pain. So pain becomes an issue because it's a part of a lot of chronic diseases, and itself can be a chronic condition if you are a person that feels pain. And there is such a thing as having pain with no known cause. A person can be in a lot of pain, body pain, and not know where it's coming from and not know why they're having it. And if they go to a doctor, the doctor can't find anything wrong with them, but still the pain persists. So what do? Well, usually you have to take medication, or you have to do something to stop the pain, and usually it's medication. But there's always a chance and a risk that you're going to get addicted to the medication. And with back pain, especially back pain, there's no way of telling how bad it is. How do you describe it? Is it achy? Does it throb? Is it continuous? Is it sharp? Is it dull? You know, there are various words you can do to describe it, but who's to say what pain is like? If you ask a woman who's gone into labor and she's having intense pain of labor, what is that labor pain like? How would you describe it? Well, I've heard, and I've never, of course, had a child, and I've never been in labor, and so I can't tell you exactly what it's like, but I have heard people say that if you have a gallbladder attack, sometimes the gallbladder attack is just as bad as labor pain. But I've also heard people say, this is on television, that once the labor pain gets to be so high, it never goes any higher. It gets to a certain level and it can't go any higher. But I've only heard that once. And whether that's true or not, I can't ascertain. I have no way of knowing because, first of all, there's no way of judging what a person's pain is. And how do you say it can't get higher? You know, we don't have the words to describe it. We don't have the tests to give to know just how bad it is. You can only depend upon a person's description of what it is, or the behavior, whether they're yelling, or whether they're screaming, or whether they're crying, you know, and it's hard to describe it. But a person can say, this is the worst pain I've ever had in my life, and they're screaming in pain. Well, it's off the charts. You know, the chart, what kind of pain are you having from 0 to 10, I would think doesn't apply to somebody who may have a pain level of 22 if they wanted to describe it that way. So it is chronic. It can be chronic. It can ruin a person's life. It can prevent them from living a normal life. And in that way, pain can be chronic. And it has to be dealt with, and a person has to be helped with it. They just cannot sit there in pain on and on and on. Now, I know some people who have had surgeries, and they've had a lot of pain at the end of the surgery, and somehow the surgery has not cured them of whatever it is they had the surgery for, and as a result of that, they have pain and nothing's done about it. So they live their lives in pain. And it must be an awful thing. I would consider that to be a chronic condition. If a person has pain, nothing can be done about it. Medications don't touch it, and they're living there with pain, unremitting pain. Well, I think it might be easier to have a chronic condition without pain and manage it than to sit there all day long with pain and never be able to do anything about it. You know, there has to be something better. Some people see chiropractors and they get a lot of relief from chiropractors. Some people take herbs and kind of herbs, health kinds of things, and they get help from that as well. Some people go through acupuncture. And I've heard of people who have had, they were addicted to drugs and they have the withdrawals and they go through acupuncture and gradually the symptoms of the withdrawal go away and they're all right again, but they have to keep up acupuncture treatments. So I think sometimes alternative treatments, although a lot of people prefer not to use them, there's no reason why they shouldn't be used if they can be used safely and if they help a person out of whatever it is that their problem is. I had a friend of mine who's a chiropractor, and a baby came in. He's no longer around. He passed away, unfortunately. But a baby came in, and the head of the baby was on the shoulder. You know, it just was, he couldn't hold his head up. The head was on the shoulder. And doctors had put braces on, you know, to try to keep the head up and all of that. Well, that wasn't working out very well. And who wants to wear a brace around your neck for your life? So they took him to this chiropractor, and he worked with the nerves, and he worked with his hands, and he did manipulations. And every time I went in to see this chiropractor, because I was his patient too, I could see the baby's head had gotten a little straighter and a little straighter and a little straighter, and finally the baby was able to hold up his head in a normal position without any outside help, without braces, without bandages, and he was okay after that. And it was done through a series of chiropractic treatments. So if you're a person who has a lot of pain, it's worthy, I think, and worth it to look into alternative treatments to see if you can be helped by it, by those treatments, because you don't want to live the rest of your life in pain. Now, pain can be, as I said before, judged on a scale of 0 to 10, and sometimes psychological problems like depression and anxiety can cause pain. You know the old adage, does love hurt? I read an article about it. Supposing you're in a relationship and for some reason the relationship fails and you're very depressed about it because you really don't want it to fail, but it does. And then someone comes along and says, well, love hurts. And there was a study done to see if love hurts, basically the breakup of love. Does that hurt? And it turns out it can. Because when you have lost a relationship and you have let somebody go or somebody has let you go in a relationship and they do a brain scan of how you're feeling, the part of the brain that lights up is the same part of the brain that lights up when you're having pain. It's in very, very close proximity. So the thought is that at certain junctures, yes, losing a love can hurt, and it can be shown by the brain scans. So you need to remember that pain is chronic. Acute pain can start suddenly, but it may not last long. What happens when you have pain? What happens physiologically to you? Well, if it's severe, it can cause rapid heartbeat. increased breathing rate, elevated blood pressure, sweating, and dilated pupils. That's if you're having pain. What does it do to you physiologically? And if it's severe, it has these lists. So I'm going to read this again. If severe pain can cause rapid heartbeat, increased breathing rate, elevated blood pressure, sweating, and dilated pupils. Now, chronic pain, or I should say acute pain, usually comes on very rapidly. It's very sharp. It's very bad. But it doesn't necessarily last a whole long period of time. It would last some time, enough to be problematic, of course, but acute pain may not last as long as chronic pain. Chronic pain can last for weeks or months, and the definition of chronic pain is that it has to last for at least 1 month. If you have pain for at least 1 month, it can be considered to be chronic. That's the definition of it. But it does not affect your heart rate or your breathing, but it can disturb your sleep, and it can decrease your appetite. It can cause constipation because, by the way, medication, special opioid medications for pain, do cause constipation as a side effect. It can cause weight loss, and it can cause depression. So let me go over that again. Chronic pain can last for months, or it can last for weeks, but it has to last at least 1 month to be considered to be chronic. And it does not affect your heart rate or your breathing as acute pain does, but it disturbs your sleep, it decreases your appetite, it causes constipation, it gives you weight loss and depression. So there are physiological effects to different kinds of pain. And so in that way, it also can be considered to be a chronic situation. Now, there is such a thing as phantom pain, and we've all heard about it. Phantom pain is when you've lost a limb, you've lost an arm, or you've lost a leg, or you've lost a hand, or you've lost a foot, and you think that there's pain coming from those organs or parts of your body that you have lost. So if you've lost a hand, if you're having, phantom pain, it feels like the pain is coming from the hand that's no longer there. So how can you have pain that's from an organ or a foot or a hand or arm that's no longer there? Well, of course you can't. But what happens that when an organ or a foot or an arm is removed, then the area of the nerve cells above where the amputation took place, it's usually from an amputation, they get active, those nerve cells get active, and the body gets confused as to exactly where the pain is coming from. So it feels like it's coming from an organ that's not there. So an organ that's been, or I should say an arm or a leg, a foot, hand, that's been amputated for some reason, you get pain from that area, but it's not coming from the organs that are gone, of course, but it's coming from nerve cells in the area that's getting confused as to where the pain is coming from. The body is getting confused, the brain is getting confused as to how to interpret that pain, because it seems like it should be coming from an organ that's removed, but of course it's not. So that's phantom pain. So the brain misinterprets the nerve signals as coming from the missing limb, so even though the limb is not there. Now you have neuropathic pain. You've heard of neuropathy. It's due to an abnormality in the nerve signals. Neuropathy is when you get pain basically in the extremities of your body, the periphery. The periphery of your body is going to be the organs or the limbs that are on the outside of the body. You would have neuropathy from your hands and your arms and from your feet and your legs. Those are the most external parts of your body that are. You don't get it internally, you get it from external parts of your body, hand, feet, arm, and leg. And it's due to the way that the nerves, the impulses are being interpreted. Now, actually, for neuropathy, you don't have to be a diabetic to have neuropathy, but a lot of people who are diabetic do have neuropathy, and it's an odd kind of pain. I know one of my foot doctors said to me once, people say they've got neuropathy, and it's not real neuropathy. The pain is like other pain. But neuropathy is different. It's kind of halfway between a pain or an itch, or you can have flashing sensations. There's no way for me to describe what that is, and of course it's difficult to describe what pain is anyway. But when you get these sharp little sensations in your legs and your arms, and then it disappears for a while, and then it may come back or not, that's probably neuropathy. I used to tell the doctor it's halfway between a pain and an itch, but at any rate, it's hard to describe it. People do have neuropathy that are not diabetics, and it's due to nerve damage. Diabetics get it because the nerves are damaged by the high sugar. But nerves can be damaged by other means, so it's not always diabetes that does it. Now, you can get pain from infections such as shingles, and that's neuralgia pain. I've had shingles, but I never had a lot of pain with it, but I had a lot of burning sensations. I had it around by my neck and shoulder, and it felt like somebody took a hot iron and put it on. It felt like a bad sunburn, and it looked very, very deep red, like I sat in the sun way too long and I had a very bad sunburn. But people who have shingles can have extremely severe pain. I've seen people go to the emergency room because they've had severe pain, and it's been from shingles. And shingles, it can form a rash, a very odd rash, and it can spread anywhere, but only on one side of the body. There's something about the nerve structure that when you get shingles, it will appear on one side of the body, but it won't appear on the other side of the body. It's one side of the body only, and you can have a very deep, excruciating pain that can actually send you to an emergency room because it's so bad. And they look at it and said, oh yeah, this is shingles, and then they give you medication for the shingles. Sometimes they give you an antibacterial medication which kills off the infection caused by the shingles, but sometimes they don't. And so if you don't have medication for it, it will kind of, you get these little kind of blisters that form eventually from the rash, and then it disappears in about 3 weeks. Usually in about 3 weeks, then the shingles is gone. But you can have it. Usually a person, if they have shingles, they only have one outbreak of it. But you can have as many as 2 or 3 outbreaks of shingles. Usually not, but you can. And then after that, you never get it again. And you know what gives you shingles? You have to have chicken pox in your history in order to get shingles. The virus from the chicken pox stays in the system even long after you're recovered from the chicken pox, but it still stays in your system, and every so often you can have an outbreak of the shingles. Now, you can't give shingles to anybody. If I have shingles, I can't give it to you. But if you've never had chicken pox, I could give you chicken pox. But if you've had chicken pox, you're not going to get shingles from anybody. Your own body gives you the shingles. You can't catch it from anybody. And I know that people have said, well, you've got shingles, can I catch it? No, you can't catch it. If you've had chicken pox, then you can't catch it. There's no way that a person with shingles and having a lot of pain can give it to anybody else. But if they've not had chicken pox, they might get chicken pox from you because it's the same virus. And so it gets to be complicated. So that neuropathic pain is due to an abnormality in the nerve signals. And infections do cause neuralgia, burning, and pain in the area of the infection, whatever it is. You can also get reflex sympathetic dystrophy, which is a kind of a nerve pain, and it has swelling and changes in tissue. It gives you a stiffening of the joints and so forth. So there are different kinds of classifications of pain that I want to go into. Now, idiopathic pain has no known cause. You have a lot of pain, but you don't know where it came from. A doctor can't find a reason for it. You know, you're having pain, we don't know where it's coming from, there's no injury, there doesn't seem to be any infection, we don't know where it can come from, and it's just pain and you have it, but it has to be treated. Now the treatment of pain is this: you can take opioids, which are narcotics, you can take non-opioids, which are called analgesics, and this would be like aspirin, acetaminophen, or you can have adjunctive analgesics. So let me go over this quickly because we're kind of running out of time. Opioids are all related to morphine. They're effective, but you may need higher and higher doses to get relief from pain. They also cause constipation, and they can make you sleepy, they can give you nausea. They are addictive, so you have to be very careful as to how you take them. Non-steroidal anti-inflammatory drugs, they're called NSAIDs. They reduce inflammation, they give you moderate pain relief for 4 to 6 hours, but they tend to irritate the stomach like aspirin, so you can get an ulcer. Too much aspirin will cause ulcers, stomach bleeding, abnormal bleeding, and believe it or not, ringing in the ears, which is called tinnitus. Acetaminophen does not cause bleeding, and it lasts for about 4 to 6 hours, but you can get a lot of liver damage if you take too much. You have to be very careful because you can kill your liver. Non-drug treatments would include cold compresses, warm compresses, ultrasound, nerve stimulation, acupuncture, and biofeedback. So there are various things you can take for pain. I do consider it to be a chronic condition, which is why I've gone into it during these last 2 segments, because you don't want to live with it. It's very difficult to live with. Something has to be done to help you, and it has to be analyzed to find out what kind of pain you're having and what they can do to help you, what kind of medications you can take, and what the dangers are of those medications. Can you get hooked on them? And if you take something that isn't an opioid, you can still destroy your liver. And if you take too much, you can go into liver failure. And so it gets to be a serious thing. It has to be managed so that you can live a normal life. And there's only so much pain that you can tolerate. But what that is depends upon their personality, because some people can take more than others. Well, I'm going to close it here because we've come up to the end of our time. But if you have pain, do something about it, see somebody, go to a pain clinic if necessary. You can get help with it, and you certainly don't want to live with it. And it can become a chronic condition in itself. So I list it as a chronic condition in these classes that we're going back into on chronic illnesses. So I'm going to close it here. We'll be doing something else next time. Please join me then.